So in the symposium last week, we talk about the speed and about the manufacturing. We have like one part only for talking about this, and I think that is as I said before, it's a really critical point. The rapid and reliable manufacturing means that the time will be shorter. So in this kind of patient with a diffuse large B-cell lymphoma, that is a really aggressive and that can be like a faster, a really aggressive disease in a really short time. This waiting time is really important to be as shorter as we can, because during after the apheresis we need to control the disease with a bridging therapy or radiotherapy or whatever, but sometimes it's really difficult to control, and sometimes unfortunately the patients can't wait and can arrive at infusion. So the manufacturing, the rapid manufacturing and reliable manufacturing, I think that could be, really, really important.